Thank you again for joining us for the alphabet soup of SSI and SSDI, what you need to know. Just quickly, our mission and vision here at Autism Society of Greater Akron. Our mission is to create connections, empowering everyone in the autism community with the resources needed to live fully. And just wanted to highlight some of our upcoming events. We have under our adapted community events category, we have a fishing event coming up September 20th and our Halloween in the Park on October 12th. Feel free to scan the QR code in the bottom and that will take you to our events page. Next Monday, we have our Understanding the IEP voice advocacy session coming up. We also have Understanding Ohio's DD waivers coming up on October 13th, also a virtual program. If you are a Stark County resident, we have a parent cafe coming up. It's a 3-part series, September 22nd, 29th, and October 6th. And then just a reminder, as always, we have our free helpline. You can feel free to call at any time should you need assistance with finding some resources. I also want to highlight that we have autism guides for children and adults. These were previously, the children's guide was previously a physical guide, which is now, they're both digital, easy to click through and easy to navigate on our website. And they're great resources to reference if you just want to get an idea of how to navigate their autism journey. Always feel free to give us a call and we're happy to help with these too. If this presentation is helpful to you today, definitely feel free to make a donation to Autism Society of Greater Akron so that we can continue to do these presentations for the community. I will go ahead and introduce Robert Fenn, who will be speaking for us today. He is a public affairs specialist with the Social Security Administration. He has been with the Social Security Administration since September 1999. He assisted the public as a service representative until his promotion in 2006 as claims representative in Canton. He specialized in retirement, survivors, disability, and Medicare insurance benefits. He was promoted to public affairs specialist June 2008 for the downtown Akron Social Security Office. Robert's outreach, media relations, and public presentations cover the Stark, Summit, Mahoning, Medina, Richland, Trumbull, Tuscarawas, and Wayne counties. He was previously employed with the temporary staffing agency of Robert Half International. He has 2 adult daughters who have managed to redefine the term empty nesters. He majored in interpersonal and public communications at the University of Akron. So I will go ahead and kick it off to Robert, and just wanted to also mention questions. If you have them submitted in advance, they were sent to Robert and he's woven these throughout this presentation. But if you do have other questions, feel free to put them in the chat and we will attempt to get through those that we can before our presentation ends at 1. So Robert, thank you, and I will go ahead and stop sharing my screen so that you can share yours.
All right, thank you, Teresa. Let me pull this up. It's almost like a magic trick sometimes to make sure that you pull it up. Voila. And then when it comes up, Teresa, if you wouldn't mind, just let me know when you see that first screen.
I see it. We are good.
Okay. Yeah. Voila, there it is for me. So great. Good afternoon, everyone. Again, my name is Robert Fenn, Public Affairs Specialist with the Social Security Administration. Let me start by first saying my apologies to anyone who had signed up and registered and showed up for the prior presentation that we had previously scheduled. And so it's all on me. Please don't point that at Teresa. She's been phenomenal to get this together. There's some things out of my control, and it's called life, I guess you could say, that took place. But I'm glad you all are here today. I have a ton of information that I want to share with you. Some of it, again, as Teresa said, is based upon those questions that you sent in. I'm going to cover many of those topics. And in my experience is that my goal is to give you all the nuggets that I can. It may not fit every single individual's situation, but I'm at least going to give a broad presentation on Social Security, disability, and SSI and the differences. In my experience, many people confuse those two things together. And then there's questions about, well, my child was denied underneath the age of 18. What do I do? Or my child is underneath the age of 18. Can I apply? When should I apply? I was told that everybody's going to get denied anyway. I'm going to cover those topics. And then what happens when the child becomes age 18? What do I do, or can I do anything at that time? So that's a overall what I'm going to discuss today. And I'm going to go through each one of these slides. Please know that I am not going to spend a substantial amount of time on every single slide because some of you would like to get outside and see the sunshine. I brought my bright shirt if that would help any, but the point is you still may not want to spend all your time sitting here listening to me. So I'm going to go through some of the slides a little quicker than others. But with that being said, I'm going to see if I can get permission and what have you to have the slides still shared with you. So don't be any dismay. I'll go over the slides and get the information to you as best as I can. So here we are. I'm gonna get this started. And as stated, Teresa said that you can put your questions inside of the chat or at a later date. If you come up with a question, if you're like me, well, what happened is the question will pop up when you're in the bed or you're watching a TV show or you're doing something. Also, why didn't I ask that? Teresa and I will stay in contact, so you can email her, and then when I give her the answer, then maybe she can share with everyone. So that way we all can learn at the same time. It's been a hectic week already, and from last time. So as stated, I'm public affairs specialist with the Social Administration. So every now and then I have to put the little extra picture you see on the side there. That's me, at least in my mind, every now and then. So if you can do that yourself, hey, join me in the efforts there. Helps me with my self-esteem issues. So let's get this started here in terms of our presentation. I'm going to cover again the disability programs. What are the differences between the two? And I'm going to give you the definition, because the definition of the two programs will help you have a better understanding of Social Security disability and SSI. And I'll cover a little bit about substantial gainful activity as well. For those of my Matrix fans out there, you're going to see two different pills, if you will, in front of you. On the left-hand side is going to be the blue pill. On the right-hand side is going to be the red pill. On the left-hand side, Social Security disability, SSDI, you may hear that term. On the right-hand side is the red pill. It stands for Supplemental Security Income. Notice at the bottom of those two circles, those spheres, those pills, Medicare is tied with Social Security disability. Medicaid is tied with SSI, but Medicaid goes through Job and Family Services. Two different programs, just that Social Security office is responsible for the Social Security disability and responsible for the SSI applications. I need to make sure I start with this. Every individual who's over the age of 18, we will take the application for both of those programs. Sometimes people will ask me, well, can I go ahead and apply for SSI? I didn't get to apply for SSD. Or can I apply for SSD? You apply for both of those programs are applied when an individual contacts Social Security. So it's not an if or an or. Now, if we're talking about a child, let's say someone who's 6 years old, right? We know that that person has not worked enough. So therefore, it's an SSI application. But many of you may come across other adults who ask that question. So I just make sure I want to put that out there. When a person's over age 18, we take an application for both. And I'll cover again what happens when a person reaches age 18 if they're already getting a benefit. But I just wanted to make sure I said that to you now. And I'm going to break down those two different parts. And you'll see in this presentation, I'm going to go over Social Security disability first, and then I'll go over to SSI, Supplemental Security Income. The Medicare portion that was at the bottom of those two spheres. Medicare, again, is for individuals age 65 and older, or if they're receiving Social Security disability 24 months after they started receiving that payment. Medicaid, again, is through Job and Family Services. It's a state health program for individuals of low income. Disability itself, this is the broad umbrella. In short, I'm not going to read every single word on the screen there. Yeah, I don't want everybody getting up and walking away, even though I can't see you, but I would know it. And that is the individual must have a condition that is expected or could last for at least 12 months or the possibility of them passing away. That's the definition. Job and Family Services, workman's comp, unemployment, your employer, they all can have different definitions for disability. This is ours at Social Security. And so that's why someone could say to us, well, the military or Job and Family Services or whoever it may be, they approved them. Why can't you? Well, the definition could be one of the reasons why. Again, it has to be expected or expected to last for a continuous period of at least 12 months or the person passing away. I point this out because it doesn't say you have to wait 12 months. It's just that the condition could last for at least 12 months. Social Security disability is based upon individual's work, and we translate that word work into the word insured. The individual has worked enough in order to be insured to get Social Security disability. Social Security disability is for individuals who are less than their full retirement age. If you're familiar with the retirement program, we have something called full retirement age, meaning if I reach this age, based upon the year I'm born, I would receive my full benefit. So what if someone is not able to continue to work until that full retirement age? That's when Social Security disability comes into play. There's certain tests in which we give in order to see if a person is insured for Social Security disability payments. We have what we call our earnings test, and we look at their recently working as well as the duration of work. The earnings test, what it does is starts with every year we have a dollar amount, which we call a credit. So this year in 2025, if a person makes $1,810 gross, they can earn one credit. They can get as many as 4 of those credits each year. 4 times 1810 is $7,240. Sorry, there's a little bit of math here. But if a person makes $7,240 this year, they've earned their 4 credits. I have to say this, that a person cannot walk into a Social Security office and say, hey, I have $8,000 in cash. I want those 4 credits that the bald guy was telling us earlier. It doesn't work that way. You have to have work, getting a W-2 or self-employment wages for a person to be eligible for Social Security disability, and those credits, again, is based upon work. 4 times 1810 gives you the 4 credits. And the goal is to have what you see in the middle of the screen here, a recent work test, which is based on your age at the time you became disabled, and a duration of work test. So let me explain that a little further. Recent work test. Now, there's a lot of words on the screen, I know, but I'm going to break these down a little bit for you. And I'll start with the one at the top on the left-hand side. It says in or before the quarter you turned age 24, meaning that the person become disabled the same quarter. Each year there's quarters, January through March, April through June, July through August, etc. When July, not through August, but January through March, each quarter. So if a person became disabled in that quarter, they would like to know, did they have 1.5 years of work during the 3-year period ending with the quarter you became disabled? There's a lot of words up there. And then the next one, it says in the quarter after you turn age 24, but before the quarter you turn age 31. The easiest way for me to explain that to you is just simply say this. Let's say I'm speaking to an individual and they are age 26, right? We're going to find out, if the person is age 26, then we're going to find out, did they turn age, when did they turn 21? You see in the middle of the screen here, after you turn 21, and we should simply go half up to age 21. So if someone is 26, back to age 21 is 5 years. Did they work half of that, which would be 2.5 years? And that's in many of the cases for Social Security recent work tests. So we have to say, recently did you work, paying into it. The way that I try to understand it and explain it is those of us who have car insurance. If you have car insurance and you are paying it, and then unfortunately you get to an accident, they'll say, recently, have you been paying this? If the answer is yes, then you're covered. If you go a couple years and you haven't made any payments, and you get into an accident, they're going to say, recently, you have not been paying us, so therefore you're not covered. So the person must be recently paying into Social Security disability, that FICA tax, in order for that person to be considered recently working underneath the disability program. Once a person reaches ages 31, they need to work 5 out of the last 10 years. That's the last bullet point that you see on the left-hand side there. 5 out of the last 10 years. So if I'm over the age of 31 and we are in 2025, go back 10 years, gets you to 2015, have you work at least 5 of those years. this is where the beginnings are in terms of becoming eligible for Social Security disability. So some individuals may not have worked recently enough, and that may make them ineligible. Duration of work. Now, I don't have every single year that a person can be born in. You can see on the left-hand side, 28, 30, 34. But this is just a little average that you can have. So we have to have a duration of work. So recently, have you been paying into the system? But how long have you been paying into the system? You know, how long did you work? So if you're before the age of 28, did you work at least 1.5 years? In the middle of the screen, age 46, did you work at least 6 years? So there is a recent work test and a duration of work. And so some people may not be eligible because they haven't met both of these requirements, duration or the recent work test. And some people are eligible. So I just want to highlight that again. A common question I receive is, when should I apply for disability benefits? Let me be very frank, direct, curt, I guess. It's really up to the individual. It's up to you. And if I can bring in the real world, I work out of Canton, Ohio. And years ago, the Hoover plant closed. And I would speak to some of those individuals, and then they will say, you know, can I apply for Social Security disability? And they stopped working. And then so immediately I knew that the company, the factory closed, but I would ask the person, so when did your disability start? And then they'll say, even though this was probably, let's say it was around 2005, but they'll say this happened in 2000 or 1990 something, whatever it may be, because I knew that individual was continuing to work, because the real word is that we try to pay our bills, we try to take care of our families and what have you, and we're going to push through that. And so Social Security disability will ask the question, you know, well, when do you believe that you first became disabled? When do you believe that the condition could last a year? And many times those individuals at the Hoover plant, they worked as long as they could, but that condition had already lasted a year, or it could last a year. So it behooves everyone to apply as soon as you believe you can and want to apply. The application itself can take anywhere between 3 to 5 months now. For the most part, in the state of Ohio, it is less amount of that time. I think right now they're at 100 and some days, so that gets you a little over 2 months for the application to give you a decision. Substantial gainful activity. I want to point that out. When a person applies for Social Security disability, one of the questions that we ask is, are you or are you not working? And this year in 2025, we're going to ask, are you making more or less than $1,620 gross for Social Security disability? Remember, I'm talking about that blue pill that we first saw here. If someone says, I'm making less than that, $1,620, they still can apply and have that application continue to the next process. Unfortunately, many people think that if you're working, you can't apply. That's not true. It's how much you're making to determine whether or not we can go to the next step to giving you a decision. So in 2025, if a person is making $1,620 gross or less, we can continue with that process. If they're making more than that, we can still take the application. You know, legally, we can still take the application, but they may be denied based upon that they're still making over substantial gainful activity. If the individual is blind, that dollar amount, the 1620, is increased to $2,700. How do we figure out the payment? The payment is based upon, remember I just showed you that $1,810, those credits. How much a person pays into it determines how much they can get out. Other income and resources don't affect it. So if the individual had savings, pension plans, or stocks and bonds, or whatever may be saved up for Social Security disability, that is not a factor. All right. We also adjust the payments each year for based on cost of living increase. Now, what I want to add to this is that I've had some people ask the question. I know what group I'm speaking to. This is the autism group, you know, that I'm speaking to. But sometimes individuals will be diagnosed with one condition, and then unfortunately something else happens. Let's say they had a bad back, severely bad back, and it stopped them from working. Then time passes. Unfortunately, they're diagnosed with another illness. Many times people will contact us saying, hey, I no longer have the prior condition. I have this now. And because the second thing is more severe, they think that will increase their Social Security disability payments. That's not so, because the payment was based upon them having diagnosis, regardless of the severity. So it's not based upon the condition itself. You know, some people can be diagnosed with 4-stage cancer, and someone could have an issue with their heart. It's not a pick or choose. You know, this one's more serious than this one, so now you get more money. It's what you pay into it, and then you apply for it, and then you become eligible for that payment based upon the fact that you can no longer do the work that you're doing, which I'll go into in a moment here. So again, no one can contact us if a condition, if another condition appears. A common question I receive is, well, there's some type of waiting period for me to get the benefits, the payments. The answer is yes. I'm going to give you a simple example on the screen here. You'll notice in the middle here, it says disability onset. That's where the doctors come back and say, this is the date that we believe that the person's condition was so severe that they cannot continue to work. Notice it's not the date that the person may have applied the application. It's not the date when the person said that they felt like they could stop working. Those dates all could be different. So someone can submit an application in January. This is when they stop working, but the doctors may come back and say, well, in June, we believe this is how your condition became so severe you couldn't continue to work. So here's the example I'm sharing with you. Let's say someone's onset date was June 15, 2023. Their first payment is going to be 5 months after that. So you have July, August, September, October, November, and December. So December is that month that they're eligible for. December's check is paid in January. All right. So the person has to live through that whole month and they get paid. Social Security is 1 month behind. So June is the month that they're eligible for, but it's the first full month. So we got, again, July, August, September, October, November. December is that month that they're payable. And I'm going to go over that SSI application component. If you notice at the bottom, it says SSI may be paid during the 5-month waiting period. So that means some of their time that they're waiting, in my example here, June all the way through December, we may be able to kick in SSI just for those months. Who is eligible for a payment? So if someone files for Social Security disability, the family members also may be potentially eligible. So the first one here says payable at age 62. So let's say that you have one spouse who unfortunately has a disability. That spouse will receive their Social Security disability payments. Their spouse could potentially file on their record if they are at least 62. The next one here says at any age caring for a child under the age of 16. This is a little bit different. So let's say you have a gentleman who's receiving Social Security disability, and the gentleman is married, and the gentleman, between he and the spouse, they have a 14-year-old daughter, right? So that other spouse, regardless of their age, may be potentially eligible for what we call a spousal payment because there's a child in the household under the age 16. So let's say the other spouse was 52. So this 52-year-old could be receiving a spousal benefit or a parent or auxiliary benefit. They're receiving a parent benefit until the 52-year-old individual, once their child reaches age 16, then their check would stop as the adult. But I say this because we're going to ask you this question, which I don't know what it is, but sometimes I ask this question and I expect only a yes or no answer. But sometimes I will say, hey, have you ever been married? And then I get silence. I don't know why there's any silence. I think most of us should know whether or not they've ever been married. But we're going to ask that question because we're looking to see if someone else is potentially eligible for a payment. The next one here. Now, this one is what I call my Elizabeth Taylor or Mickey Rooney clause. Paul McCartney's on the list. Neil Diamond's on the list. Larry King's on the list. And Halle Berry's on the list. But she's on it just because she's Halle Berry. That's all. That's for anyone who has an ex-spouse. Not that Halle Berry's my ex-spouse, but dreams can be dreams. Never mind. Moving on. The point is this. If an individual has been previously married and that prior marriage was at least 10 years, the ex-spouse is also potentially eligible. Now, I need to say this. It does not lower your check. So if someone's getting Social Security disability and they have an ex-spouse, and they've been married for 15 years, more than 10, the ex-spouse could potentially file on their record. Now we're going to compare to see if they're due more money on their own or if they remarried themselves, and that will make them ineligible. But if they had not, then they may be able to file on their prior spouse's record. And again, it does not affect them. The bullet points at the bottom, not married under the age 18. So you have an individual receiving Social Security disability and they have a child under the age of 18. That child will receive a Social Security check until they graduated from high school. Or if the child has a condition or a disability that started before the child was age 22, they could receive a benefit off their mother or father's record for life. So the first bullet point, it would stop once they graduated from high school. The second one would continue for life. How much did they receive? 50%. 50% while the mother or father are receiving Social Security disability, up to half of the amount. So if mom or dad was getting $1,000, half will be $500. The child will receive that $500. If mom or dad passes away, then we pay 75% of what mom or dad would have received. 75% of the $1,000 is $750. I had to keep it very simple, simple math. I'm not that great at that. So in both cases, the amount of all children on workers' record have a family maximum. So I don't want anyone to think, well, what if I had 13 kids? We're going to get $1 million. No, it doesn't work that way. We have a maximum amount off of each person's record. So it's kind of like a life insurance policy. You have a face value and then a cash in value, what have you. So again, we pay starting point, the children up to half, and then we see how much we can pay off of them. So let's say someone's Social Security check is $1,000, but their family max on the record could be $3,000. So I know there's $2,000 left payable. So we'll try to pay $500 for each person. The more people who are on their record, when we lower the amount of each individual check. So you had $1 and I had two people to split it up. Everybody will get, two people will get 50 cents. If I have four people, everybody's going to get a quarter. So there's still the maximum amount. It would be the dollar in my example. Benefits are payable to children, payable to children under up to age 18, as I mentioned, and then they will stop at age 18. So that's one of the screens I said I'll keep going through. We do have disabled adult childhood benefits or childhood disability benefits. This is a case where, let's say someone who's age 46, they're 46 years old, and they believe that they had a condition that started before the age of 22. Even though they're 46, they could look to file on their mother or father's record if that mother or father is deceased or getting a Social Security retirement or disability payment. This is not as common, but I still rather inform the public and inform you of this. This could be a case where it's a little more difficult to be approved, because it's not what you know, is what you can prove, right? You've heard that phrase, because many times when I'm speaking to someone, I'll say, I understand that you're looking to file on mom or dad's record and you yourself are an adult. But do you recall when you first started to have signs of having a disability? Then they'll say, oh yeah, well, maybe I was 5 or 6. And I say, well, do you remember the school you went to? I think it was such and such elementary. Do you know if you had any tests? Do you know if there was any doctor evaluations? Then they're not certain of it. So it becomes less likely. Still possible, but it's less likely. But we do have that benefit for disabled adult child or childhood disability benefits. How does a person apply? You can go to our website, socialsecurity.gov. And technically, you don't have to type in the / disability in the middle of our screen, and I can show you. I think I have a screenshot, but Social Security disability has the word benefits on our homepage. You can click on that, and I saw that Teresa has been sharing some links that I sent to her. This is great information, so she'll be able to share that with you. I believe it's going to be placed in the chat, and you can click on one of those links and you can see how to apply. And there's also benefits, and I have pamphlets which you can refer to. So you can contact us via the computer or calling the 800 number, 772-1213, 8 a.m. to 7 p.m. Now, please note, we have what we call appointment focus now. That means that no one can just walk into the Social Security office and say, hey, I'm going to apply for benefits. Any individual who walks into the office, and I should say any, majority, 99.9% individuals are going to look to, if they walk into the office, they're going to have an appointment made for them. So that way they believe that they can specialize on and give the individual the attention they need versus having the floodgates open up into our office. So if you go to our website, Social Security Disability, and you hit the enter button, we receive the application and we still will contact you. So it's not as if you hit the enter button and no one will say anything to you. In the application, there's a box for remarks. You can still answer and put your questions in there. If you call the 800 number, they're going to give you an appointment, and the appointment will be in 2 weeks, a month, whatever it may be, and then that someone will call you back to take that application for Social Security Disability. Again, if you walk in, that person's still going to give you an appointment. You go to the computer, they will receive the application, and then we will tell you when we're going to contact you, or we will call you and say, hey, do you have availability this week in order to complete the application or to go over the application? This is the screenshot I was mentioning. You can see the word benefits or the word apply. You hit either one of those and it'll bring up this screen, and then you can decide if you're looking for retirement benefits or disability benefits. This is the start of the application. Something I want to cover quickly with you. I know that many of you are helping loved ones, and this could be, even though you and I are discussing this conversation in terms of maybe for your children, but maybe some of you help other individuals out. So there's certain forms if you're going to help someone else out with the application process. We call it an SSA 3288, SSA 1696, and then the legal guardianship and POA I'm going to discuss here. The SSA 3288, that is a consent. That's a one-time interaction. You needed to contact Social Security today to talk about, is the phone number correct, or to get information to see what is on our records or something like that. It's pretty quick. It's a one-time transaction. 1696, appointment of representative, means I'm going to be assisting a person throughout a process. Applying for disability. And so you need to submit forms, you need to ask questions, you need to get new forms. That's what you would use as the 1696. If someone is a legal guardian, we do want to know that because it takes precedence. We have to give that legal guardian information, not as terms of telling them everything that's on the record, but if there are changes, or if someone else is going to be managing the benefits, we need to let the legal guardian know that someone else is doing that. Social Security does not honor power of attorney. Please spread that word. Many people think, well, I have power of attorney, and because of that, they think that they can contact us and get whatever information they need. Power of attorney is a state governing issue, not federal. And there's different forms of power of attorney, whether it be for medical or for judicial. So I encouraging you to let people know that Social Security is not going to just accept someone's power of attorney documents. Now, what we have is the term called representative payee. That means one individual is responsible for helping someone else handle their affairs. So we would have John's name next to Sally's name on our record saying that John is helping Sally or Sally is helping John with their Social Security payments. We may ask John or Sally to bring to us their documents if they're a legal guardian or they have power of attorney to justify the reason why we made them a representative payee. But if a person is not POA or they're not a legal guardian, they still could be a representative payee. Many of you may be married and you still help your spouse out, financially, in terms of, the household. So you know that you don't have POA, but you do help your spouse out. So just be mindful of that. Social Security does not solicit an honor power of attorney. What happens next when we get the application? The application is reviewed by a group in Columbus called DDS, Disability Determination Services. The technical term now is Ohio Opportunities for Ohioans with Disability, but it's still DDS in Columbus. Let me explain a little bit about how that works. So it's a state agency, and this is where the doctors and the specialists are. So the local office is the place who physically or makes a decision. We're the ones who take the information that you're providing to us. The DDS, that's where they use the medical evidence from all the doctors and all the information that you send in. Many times, and I think this is a good opportunity for me to insert this, many people will say, well, my doctor said, or my child's doctor said they're disabled, or they did not say anything yet, or do I need to contact the doctor? We do need that information. We do want that information. We will send off that information. That is for free. Do not think that you have to go and pay for anything or get the information and send it to us. If you do have it, great. You can submit it with the application process. If you don't have it, don't worry. We will get that information for you. You will tell us what doctor your child goes to or you have went to, and in that way, we will be able to get the information. What I also want to point out in regards to the medical evidence, you as a parent, you are one of the, if not the, I should say, the most important individual in this. Too many times family members don't realize or they're not aware that we at Social Security will accept and want to receive information from you. Or if there's a caseworker or there's someone else who's helping you, or a social worker, you can simply write up, my son or daughter cannot do or used to do XYZ, just on a notebook piece of paper and submit that as evidence. We will use that. That has weight to it. Again, many people think, well, I just need to get the doctor's information or I need to get the attorney involved. You can submit your information too. And since I said attorney, no, you do not have to have an attorney to apply for Social Security disability benefits. You do not have to have an attorney to do so. What happens is that you can get an attorney because the attorney may understand the language, our vernacular, and they have that experience in this field, but it's not a necessity at all. How's the decision made? There's a 5-step process in which they go through. And one of the first steps they're going to find out is the individual working. That's where I mentioned at SGA. Is your medical condition severe? That's the key to it. As I mentioned earlier, how severe is it? And does the impairment meet or medically equal a listing? And I'll cover what the listing is. And can you do the work before? And can you do any other type of work? Let me explain those last 2 points. I could have in front of me a counselor and a plumber. Okay, counselor and the plumber on both sides of me. And let's say both of them lost the ability of their limbs. Which individual is more likely to still be able to do his or her job? So if since they lost the ability of their limbs, the counselor still may be able to do his or her job. All right, still articulate their thoughts and explain things, but the plumber may not. So Social Security disability is about you not being able to work to your full retirement age and not do what you used to do. Okay, not something that is just hindering you, but what is it that you used to do? That leads to the other part says, can you do any other type of work? So maybe you can't not be a counselor, but you can do XYZ within the nations. We have a database that says what type of other work could a person do with this skill set. So this is why you can see 2 individuals with the same condition, one approved and one denied. So it talked about those listings. I don't know if you've ever heard of this, but we have something called the Blue Book. The Blue Book is a listing of impairments, and it just breaks down all the different conditions that we have in our system, and that would say that an individual underneath age 18 is severe enough to cause marked or severe functional limitations. And it covers, as you see in the screen here, most listed impairments are permanent or expected to result in death. So we already have a booklet that covers what we may see of someone being possibly approved for. It's the Blue Book. You can get this, go to our website, socialsecurity.gov, type in the word Blue Book. Don't print it out. It's a lot of pages, but at least that's the information that you can have. We'll tell you your decision if someone's approved. The state DDS will let you know. They'll send a letter saying how much you're going to get, tell you what the benefit is going to be, how much it's going to be, and any reporting responsibilities you may have. If a person is denied, they're going to be told what to do. And in terms of if they wish to appeal that decision. Get this up here. Great. We have Social Security disability and SSI employment supports, because we understand that some people will still like to find a way to work to help make ends meet. So we have things called subsidies and special conditions, unsuccessful work attempts, impairment related work expenses, pass program, ticket to work. And I'm not going to break all of those things down, but there's a couple that I want to highlight for you today here. Unsuccessful work attempt. All this means is that a person says, you know what? I'm used to being busy. Or maybe you as a parent, you want your child to be able to get back out to the workforce just to gain some experience. And then unfortunately, they're not able to work much or less amount of the time and they stop working. That's what we may count as an unsuccessful work attempt if it's less than 6 months. So that's one way in which that check will continue to be paid. Impairment related work experience, an IRWE. We have uh, abbreviations for almost everything here, but IRWE. And in short, what it means is that if we're trying to get an individual underneath their substantial gainful amount, we will look at their expenses such as medications. So let's give you the example here. Let's say an individual was earning $1,550 per month gross, and the monthly payment of their medications is $75. So if we subtract $75 from the $1,550, their income is actually $1,475. So that may get them underneath that substantial gainful activity amount because we see that some of their medications and there's other expenses that we may be able to use to make sure, again, that they are eligible. There's ABLE accounts. I don't know if you've heard of them. Some states call them stable accounts, or in Ohio, I think we call it a stable account. And this is the way an individual could set aside monies. And I don't run this program, just make sure it goes to the state. And you can go to ablenrc.org, ablenrc.org, or just type in stable accounts or ABLE accounts, and you should be able to see a way in which you can save money set aside without it affecting an individual's SSI benefits or Social Security disability benefits. So again, you can save up to $100,000 without it affecting the benefit, but it's a good source I just wanted to make sure I shared with you. PASS program. We have an individual in our office who runs this PASS program, but I want to make sure I give this to you. Plan to achieve self-support. This is a way in which an individual can set aside monies because they're trying to do their own career, maybe start their own company. So I'll give you the example here. Let's say Billy wants to go to school to become a social worker, and Billy works part-time, getting $665 per month. What we do is we don't count the first $20 of it, just a general exclusion. There's another $85 $65 that we wouldn't count just right off the bat. So we've already counted $85 deducted from them from their gross amount. And so that would give you $580. We only count one for every $2 of the money that they've made. So that only gives you $290. A lot of math here today. I know, I'm sorry. $290. So let's say the SSI check is $967. $967 from the $290 would lower his check or her check to $677. But if someone signs up for the PASS program and they're approved for it, because it has to be approved, we may be able to say, well, since they can set aside $290, it's going to increase their SSI check back to the $967. And each month we know that they're putting $290 toward school supplies and going back to school. So this is one example of someone who's getting SSI only for the PASS program. Inside of the chat, but Teresa is doing such a diligent job of putting information in there. You see the Ticket to Work program. You can click on it and it refers to different counselors and who can guide you through these steps to getting that information to us to see if someone is eligible for one of these programs or the subsidies that I just mentioned. All right. I know that's a lot. So you stretch a little bit here. I'm about to take you into the SSI program. This is a little easier to go through, but I just want to cover that with you. So, all right, shake your shoulders, everybody. We're good. All right, let's go to the next step here. The SSI program. The SSI program is for anyone who's age 65 and older, or totally or partially blind, or less than age 65, and has limited income or few resources. Okay. We look at the individual's income. And so in this case here, if you have a child, we know the child is not working. And so we would look to see if there's any unearned income, and do they receive any other type of Social Security benefits or VA benefits, unemployment. So that's income. So we have earned income, we have earned income. Earned meaning they're working at the time to get that money. Unearned means something that already been earned prior, based upon work or based upon a pension or another way of retirement or disability payments. Resources. What do you have saved? We look at individuals' bank accounts, stocks and bonds. And I like to say that And you can have a second car without Social Security not even carrying, or a second home. So let's say your first car is a Porsche and your first home is a mansion. We're not going to be concerned with that. It's the extra Maserati that you have. It's the extra beachfront property that you have. Those things count as resources. We look at life insurance and any property other than where you live for an individual who's getting SSI payments. For requirements for children, the children must have a physical or mental impairment or combination that results in marked or severe limitation in function. The key word on this screen here is the word marked or severe limitation, the key words, meaning that the individual, the child has a, let's say, a visual impairment, may be eligible based on blindness if the impairment meets the definition of blindness, but it also means that the individual has a condition that could last. All right. A child is neither married nor head of the household under the age of 18 or under the age of 22, and a student regularly attending school, considered earned income. We have different domains. I like to say the word groups here, that we use to determine whether or not a child is eligible for it. And so these domains are broken down in groups, and it says, can they acquire using information? How do they understand when you're telling them something? You know, I understand that one of the questions on the document that we ask, and when we're taking the application is, you know, how well does your child listen? And many parents will say, well, my child doesn't listen at all. I just told him to clean the room, right? But if a parent understands, you know, and they can see in their child's face when they say go do X, Y, Z, and the child wants to do it, but they're not able to process it. That's the difference there. And that's why we ask that question. Attending, completing tasks. You know, are they able to use scissors? We ask that. Do they have trouble relating to other kids in their age group? And their health and physical well-being. Are they able to, if they're at the right age, at the age, can they brush their own hair, brush their own teeth, tuck in their own shirt, those types of things. So these are questions that may sound basic, but they are important to the application process. And parents who have a child who may be experiencing a disability or has a disability, they know exactly what this looks like when they see it. You know, they see the child struggling in order to understand or maybe to grasp an object. Deeming. This is an example of where many people will contact and say, well, here's mom and here's dad, and they're working, and they have a child who has a disability. And this case here, underneath age 18, we do look at the parent's income to determine whether or not the child is eligible for SSI benefits, Supplemental Security Income, for SSI benefits. If the child is under the age 18, still living at home with natural adoptive parents, you know, or if the kid lives away at school, some people may have a child going to a border school, what have you, but comes home at certain times of the year. So thus we're redeemed. So we do look at a parent's income before the age of 18. There's a little tool that I can share with you. You see in the middle screen, ssa.gov/SSI, a benefit screening tool. This is how we look at an individual's parent income. There's so many different scales, you know, 1 child, 2 children, 3 children in the household, mom's working, dad's working or not working, what have you. So I can't just share all the different levels in terms of a person's parental income, but we do look at that. Non-parental income, like for grandparents, and I had read some time ago, more grandparents taking care of grandchildren, that doesn't count. We don't look at the grandparents' income in that case. The application itself, I encourage you, if you go to our website, socialsecurity.gov, make sure you check the word yes, that you do intend to apply for SSI. That will prompt us to make sure we see if your child is eligible for the SSI benefit, or if it was an adult and you're helping them. Many people think they can skip over that. It's okay. Allow us to make that decision on both Social Security, disability, and SSI. If the child is under the age 18, you can go to socialsecurity.gov, SSI, start the application. And that was the first screen where I showed you. We saw the little red arrows. You can click on retirement or disability. You can click there, or you can call the 800 number. If the claim is approved, we will follow up just to make sure that maybe sometimes people move from home to home, or if we need to get a representative payee, someone else to manage the funds, or to see if there's been a change in the income for the individual who applied. The payment is figured this year is on 2025, $967. We subtract any countable income, and we do not count all the income you have, only the income left after you make allowable deductions. So let me explain. I'm going to give an example of that because I have many times come across individuals say, well, I can't work and get Social Security SSI benefits. So this is just one example of how it does benefit an individual. So let's say John's getting a check of $967. He has a job of $800 gross. We don't count the first $85, so you should subtract $85 from 800 is $715. And we don't count every dollar of it. We only count half of that. So if you count one for every $2 of $715, divide that by 2, $357.50 is his actual income. We're not counting 800, we're counting the $357. So if you take $357 from the 967, that means the SSI check will be down to $609. That's where people panic. You lowered my check down to $609. Well, if you look at the total amount, he's still working. $800 is his job's wages. $609 is coming from SSI. So now the take-home pay is over $1,400 versus getting the $967. So you can see there's an increase in the take-home pay. So I'm just sharing this as one example of that it would benefit an individual to continue to work. Now, I'm not going to mislead you. That can affect other things like Medicaid at Job and Family Services, because if you make more income, then it could affect SNAP benefits. It could affect, the Medicaid benefit. I don't work at Job and Family Services. It doesn't affect everyone because of different guidelines that they have, but I just want to make sure I don't mislead you that yes, it will increase the Social Security in terms of the income. And what people must know, the more you do work, that means it may make the individual increase the chances of them no longer being eligible for SSI and makes them eligible for Social Security disability. Then they don't have they have to deal with these same types of reviews where we're looking at their income and their resources each year. This is one of those screens. I'm definitely not going to go over everything. And, I got everybody squinting to look at the screen here. I'm sorry about that. But SSI, we do look at the living arrangement where the person lives to determine if it'll affect their check. If someone is living in someone else's household, with their parents, we look to see if they're paying their fair share. What fair share means, let's say, I know this is not true, but just bear with me, for example. Let's say you lived in a house and all the bills were $400 total, and you have 4 people in the household. Everybody's responsible for $100 then, right? Because 4 people gives you the 4 times 100 gives you $400. Well, if I were to move in the house with, I don't know, Taylor Swift, quiet Kelsey, if I were to move in right there, I promise you, I cannot pay my fair share of all Taylor Swift's bills. Right. I bet you didn't know you were going to talk about Taylor Swift again in the SSI presentation. But my point is, again, that's how we're looking at it. We're looking to see whether or not the individual can pay their fair share of the bills. That's SSI. If someone's living alone, but outside the home and someone else outside the home pays the rent, that could cause a reduction. If a child's living with their parents in the household, it's possible they can get the full SSI. So let's say you had a child who's age 19 now. And so they're over age 18 and they're getting an SSI payment. Since they're over age 18, we look at their income. We no longer look at the parent's income. So mom and dad could be working and we're not going to look at the individual, that the mom and dad's income is not going to affect them. Then we're going to say, well, are you paying your fair share of the bills? And if they are, then we may be able to bump that SSI check up. We won't lower it based upon them not paying their fair share. If an individual's in a medical facility, then meaning that the state is paying for more than 50% of their stay, it may lower their check to $30 while they're inside of the medical facility. If someone's receiving SSI, there's a variety of reasons why someone has to report it to us. If they change their address, if they move out of the country, they change resources, there's a variety of reasons, but the person will get this mailed to them to encourage them to inform Social Security if one of these changes take place. And what happens at 18? So let's say you have a child who is getting SSI benefits before the age of 18. Then they're going to get a letter sent to them asking for a new review because we're no longer going to look at them as a child. Remember that screen I said this is the most important, the keywords on this screen was the marked and severe. So now they're going to stop looking at them as a child and now look at them as adult. If your child already gets SSI and continues to live with the parents, does not pay food and shelter, a lower SSI payment may take place. But now we're going to look at them as an adult. Now, the people would like to know, well, when should I file for that? Where they will stop looking at the parent's income and just look at them as an individual. So here's an example. Here's Ryan, who turns age 18, June 22nd. And so now Social Security can process the application anytime from June 1st on. The earliest month where we want to look at the income is July. So the first month of eligibility, that's called a no payment sit out month. Ryan's first eligibility month is July. That first check is in the month of August. So July will be the month where we submit the application without you having concern about mom or dad's income. We do have reviews for SSI, and that's every 6 to 12 months. We call them redebts or retermination. What I want to emphasize here, this is something that the Social Security office, we're responsible for contacting you to do this review. It's not something that you have to call us and say, hey, no one's called me for the review yet for my child, or they themselves don't have to call for that. We are responsible for contacting you. You are responsible for responding once we submit a notification to you. Social Security disability, they have something called continuing medical reviews, and this happens in most cases, it can happen in 1 year, but in most cases it's 1 year, 3 years, or 5 years, and sometimes 7 years, depending on how severe the individual's condition is. This is an overview of what I just discussed, the difference between Social Security disability and SSI. On the left-hand side, Social Security disability checks come out on the third Wednesday of the month. If someone's getting Social Security disability, their family members may be eligible. That's where I said the spouse. That's where I said the Halle Berry thing. Don't tell her. Well, no, you can tell her. Social Security disability. On the right-hand side, you have SSI. And SSI, again, stands for Supplemental Security Income. Those checks come out on the first. SSI payments are not based upon work. Social Security disability is based upon your work. All right. One of the top 3 reasons why people contact Social Security is to get a Social Security card. If you wish, you can use this QR code, you can scan it. I'm sharing this because I'm finding out that some people still don't know that you can get your Social Security card. If you lose it, you can get that replaced online. If you lose your Social Security card, you can get it replaced 3 times per year now, 3 times per year and 10 times over your lifetime. 3 per year or 10 times over your lifetime. But this is how you can do it. You can go to our website, socialsecurity.gov. You answer a series of questions. And there's 2 external partners called login.gov and ID.me. They will vet who you are, and then they can have the card sent out to you. Direct deposit. It's passed now, but during April of this year, there was some type of social media going out and information that was publicized saying that if you're getting a Social Security check or want to get a Social Security check, you got to show us your ID. And so we have people lined up at different offices across the United States saying, I still want to be able to get my Social Security check, so I'm showing my ID. We didn't need those IDs. So whoever put it on social media, because I know people say, well, if it's on social media, it's got to be true. Right. Well, that wasn't true. But what is true is that if someone is getting a Social Security payment, SSI, SSD, retirement, doesn't matter, they want to make a change in where their money is going from one financial institution to the other, they can go to our website, socialsecurity.gov, and use the My Social Security account. Once they use the My Social Security account, that will vet who they are, and then they can make the change that way. If a person is not able to or does not want to go through the My Social Security portal, then the individual has to come in person in order to make the change for direct deposit. All right. So just let everybody know that if you're changing from one bank to another, you either go through the My Social Security portal or you come in person in that case, and then we have to verify who you are to make the change. If you get one of those crazy phone calls, if you receive one like mine, it's one of these phone calls with this mysterious voice saying, this is Social Security Administration. We're coming to get your firstborn, right? And they'll say something crazy and you're like, well, when you come to get him? I've been waiting for you. No, I'm just playing. You don't do that. You don't do that. Well, the Social Security disability or retirement benefits, or they'll say something like that, and you may get one of those phone calls. That's not Social Security. Social Security will not contact anyone and threaten anyone saying that you didn't apply. We're going to stop your check if you don't contact us in the next 15 seconds. That's not Social Security. We do contact you if you contacted us. you set up an appointment, then yes, we're going to contact you. But if you get one of those phone calls, the place that you should call is the FTC. Many people think they should call Social Security because the person used the words Social Security. Your Social Security number is fraudulent or is tied with some crazy drug ring or something just outlandish, and they're trying to create some sense of urgency and force you to contact them to get your money or Social Security number. Call the FTC, 877-438-4338, 877-438-4338. That's who you should contact for that. Now, I can skip over the screen, same information. That completes the presentation. I threw a lot at you. I know, but I needed to get as much as I could in front of you. I'm going to be quiet for a moment here. I'm going to open up this chat box. I'm going to get off of this screen, stop sharing.
Robert, I did have one submitted to me just privately through chat that I'll read to you.
Right.
Okay, let me just pull it up. Can my son who has autism receive benefits before I retire? And if we apply and do get it, would it impact the future pension I would receive?
Great question. Great question. And so, if mom or dad is eligible for Social Security retirement benefits themselves, their child does not affect them. Okay, so retirement benefits are not affected. Now, what would happen is in this scenario, if mom or dad gets a retirement check, we're going to ask them, do you have a child who has a condition, a disabling condition that started before the child was age 22? And that will be the case. We're going to take a separate application for that child to see if they can receive our higher check based upon mom or dad's earnings. That check amount could affect if that child was getting SSI. It could lower the amount from SSI and they will get Social Security disability or Social Security retirement child's benefit off of mom and dad's record. One, it does not lower mom or dad's check. Two, the total amount, let's say that they are eligible for some monies from mom or dad's record. Their check that they're receiving from SSI, the SSI amount may be lowered, but we may give them two checks that will still equal the amount that they did receive totally. So, okay, so I just want to make sure everyone says it doesn't wipe out their SSI unless the check that they're due from mom or dad was higher than the SSI check, then they're no longer going to get SSI. They will get a what we call auxiliary benefit from the parent's record. Hopefully that answers their question.
Another one is there any transportation assistance provided through SSI or SSDI?
Oh, great question there. So as an agency, no, we don't have anything that we have a system which allows people to access to transportation. You would have to find those other sources, and they will use the fact that you're eligible for Social Security disability or SSI to justify how they could assist you. So there are other sources out there, but not through Social Security. Okay.
Gotcha. I was trying to look through the ones submitted before, but it looks like they're mostly kind of incorporated in your presentation. If anybody else has a question, feel free to submit it in the chat before we end the webinar. Going once, going twice. And again, if you have questions after the fact, like Robert said, please feel free to respond to the recap email that I send to you, and I can follow up with Robert to get you the answer that you need. And I think just a reminder, Robert said, if you do plan to go to the Social Security office, make sure you have an appointment so that you know that you can get help when you go.
Yes, definitely. Because when you get there, I'm telling you, they're going to give you an appointment. So I'll try to save you some gas because gas is going back up. Was it $75 a gallon, whatever it is now? So just make the appointment, 1-800-772-1213. And again, I just want to say, again, thank you, Teresa, for this opportunity. Thank you for those who joined us today. If you weren't able to before, I'm still going to share this information. And Teresa, I'll try to see if I can get this consolidated, the presentation, and I'll have it forwarded on to you so that we can share with those who attended today or weren't able to. And those links are great too. Yes.
Yes. Thank you very much, Robert, for being here. I really appreciate it.